Hello, my fibromyalgia friends. How's it going? It has been a while since I've done a live stream. So I just, again, randomly have decided to hop on. I keep getting delayed. So I had to just follow through and do this. Hello out there to everybody watching on Facebook and YouTube. Please drop a comment or emoji. Let me know how you're doing and check in where you're tuning in from. I am Melissa Talwar. I am the executive director for the National Fibromyalgia National Health Organization. I am also currently in nursing school and I am a board certified functional medicine health coach with extensive training in functional medicine. I wanted to jump on here to just have a discussion with you, hear what everybody is thinking for the new FDA approved medication for fibromyalgia. I know there's a lot of conversation and posted across social media already, but I thought I'd do a live conversation. So we'll get started with that. And then at the end, I'll provide some updates because I know I've been a little bit missing in action here. And we'll get some updates about everything that's want to do and what's happening also in my life as well. But let's just get started with the first point. So have you heard that we have a new FDA approved drug for fibromyalgia, Tonmya? And I hope I got that correctly. I've been trying to listen to the pronunciation. So Tonix Pharmaceuticals, who I've been familiar with for a while, just got FDA approval for this new medication. So we're going to dive into that. What have you heard? What do you know already about cyclobenzaprine? Now, this is sublingual. So I know there's a lot of conversation about, okay, like this has been available for a while. Yes, in a different form. If you have been prescribed Flexerol, you've probably seen this form like oral tablet before and taken it. So this is a new reformulation, sublingual. And this is what we'll kind of dive into. Just want to get your feedback, what you've learned. It's not available on the market yet. I'm hoping that we do a good job of making it more available and accessible and affordable to everybody with insurance coverage as it gets released. But I don't know, there's mixed reviews on the internet. And that's why I think it's important we have a discussion and have a balanced discussion, because I know that you may have seen this cyclobenzaprine in other medication forms before. You might have tried it before. And this is going to be new to our community, new to some people. And that's why I just wanted to open up the discussion here and also say hello to everybody. Hi, Sonia. Good to see you. And definitely this is going to be news here. Let me know. Again, this medication is not available. It's supposed to be available maybe in the fourth quarter. And we are not sure what's going to happen with insurance companies, how long it's going to take. But it's definitely something to look at. And I know, again, there's mixed feelings. So this is why we just bring this on to have live conversations and talk about it, because we did post about it. And I know we've taken this before. And that's why I wanted to address it. So, but I took it a couple of times. Yet this is going to be a mixed bag as well. So from my personal experience as well, I've taken Flexerol. I took Flexerol early on, and I couldn't handle the sedative effects. It made me really sleepy. And it kept accumulating in my system. So I would continuously get more and more sedation to the point that I was super fatigued and dizzy as well. Later on in life, I actually met a rheumatologist that said I should try decreasing the dosage. So what I did was I cut the tablet in half of a half. And that was a little bit more helpful. I didn't take it for a long period of time. I took it because I was having surgery and he said it would help. I also used it once in the hospital because I got really, after a surgery for my broken wrist, for some reason, I deteriorated a lot when I was in the hospital and they kept giving me pain medication, but it wasn't working. So they gave me a dose of cyclobenzaprine and I was able to actually get out of the hospital. So there's something to it. I don't know. I know a lot of history with fibromyalgia. They say it doesn't work for fibromyalgia, but when we're talking about sleep and getting pain, if you can get the muscles to relax at bedtime to get better sleep, potentially. But I know with Flexerol, there have been problems with the sedative effects. It's dose limiting. There's a different side effect profile. So I think that's what Tonix Pharmaceuticals, when they released this, has addressed. I've been listening to different interviews from the CEO talking about that. So one of the big focuses that they wanted to look at for this medication was looking at addressing this non-restorative sleep in fibromyalgia. So that was a huge reason for this to come out. And they've been working on this for a long time. They've pushed through as a smaller drug company and stuff like that to try to create this. I do see that the lower dosage might actually, and we don't know because we need patient reported. We know what they did in the trial, but once it gets into all of our hands, especially the sensitive people on our hands, we'll see patient reported experiences and that will be good. And see, this is where it's like you can take it and stand, but like one thing to ask your doctor is if you are taking it or if you're noticing it's just too sedating, is maybe trying to lower the dose. And this has been problematic in our country for a while, is how to titrate the dosages. A lot of medication don't come at lower dosages. So, if it's not extended release, you can cut it. And if they have a line, you can cut it, but talk to your doctor about that. So this formulation is going to be sublingual. So you're not going to swallow it. It's going to have a direct line into your brain system, circulatory system. It's going to bypass the first pass effect, which is what they talk about on the website as well. And they do have a website. Let me just put it there. This is mainly for, I guess, directed at providers, but all of us are really good fibro nerds. And that's why we call ourselves fibro nerds over here, because there's the link. I just posted the link for the actual website. So we're basically managing our own health. Many of us have to figure this out on our own. Many of us end up teaching our medical providers. So yes, so this has been the first FDA-approved therapy for treatment of fibromyalgia in adults. There's going to be some caveats in this experimentation that they did with the clinical trial, which we'll get into. And I'm also going to share one of the PDF for the prescription PDF that they have on their website. And I'll try to do my best here. I'm a little fatigued with nursing school, but I did want to talk about this and highlight it because there's just been such mixed conversations. And I don't want to discount what's happening because, yes, this is, we talk about cyclobenzaprine and we had it before, but the fact that this is a sublingual form and available at a lower dosage could potentially be helpful for those of us that are super sensitive to medication, although the delivery is going to be quite fast once you put it into your mouth and you absorb it as well, which I hope is a better experience than what many of us have felt before. And that's the thing that I wanted to address too, because I know there's like I know it's hard, but like we are celebrating the fact that we have an alternative. Yes, it seems weird, but I think we're trying to get it to focus on, let's see if it helps with sleep. And pain insomnia is a real thing for many of us. We can't get to sleep. It's hard to sleep when we're constantly in pain at night. So taking this hopefully will help with that effect and then getting some sort of sense of sleep as we wake up in the morning and we can see. Now, hopefully it doesn't end up having that sedative effect that, we see in things like Flixerol and like actually start to build up too. So it produces this effect later on. So I'm hoping that it negates this, and based on their documentation, that's what they were trying to do with this new formulation. They do take it up to a higher dosage. So I think eventually you're going to go to 5.6. For some people, that's okay. Like if I were going to get this, I'd probably remain at the lowest dosage possible for as long as I could if I got some effect from it, especially for sleep, because that is something I struggle with still to this day. But I do like the fact that there's another option. There's another option for fibromyalgia that doctors can actually take a look at. I don't know what the success is going to be, but we're already aware of the other FDA-approved medications. We're already aware of the prescriptions that get prescribed off-label that have a tremendous amount of side effects. And I know on previous videos I've talked about, I have some complaints about duloxetine and Cymbalta, just because I've heard what you have to say. And I've heard that, in order to titrate off of something like that, you have to start counting beads. I did do some extra research, by the way. There are some more compounding pharmacies that are giving lower dosages of Cymbalta available. It stinks because it's out of pocket, but those lower dosages can help you withdraw, titrate a lot easier from these compounded pharmacies. So that's good. But the fact that you have to do that is super cruel. So the fact that we get another option for medication for the first line of treatment, potentially for fibromyalgia, is a good thing. We need more options. Yes, this is not going to be the end all cure all for fibromyalgia, but if it helps you get more sleep, we really haven't done enough research into the sleep effects of fibromyalgia. So this is actually a good thing to actually see. Definitely, if you are going to try this whenever it comes out, make sure you are ready to go to sleep because of the sedative effects. Do not be driving. Do not take this and go drive. So that is one big, huge thing. Understand the education behind this, which is something that we're going to dive into as well. So it's definitely taken at bedtime. It is designed to improve your sleep quality. Let me see some of my notes here. And the whole effect of this, again, is to be absorbed rapidly for sublingual and avoid heavy metabolism in the liver, because you wanting to reduce, what they tried to do was reduce those unwanted byproducts in the medication for things like cyclobenzaprine, for what you're seeing with the effect of the other medications that cause grogginess. So hopefully this will be like a good night's sleep is what they want to see. And that's what they saw during their trials. Now, a case when it goes out into the wild, wild west of the world, and you have people like me that are super sensitive to medications, we'll have to see. And this, I do like the fact that we're going to need some good, solid patient reported effects. We need to see the side effect profile in different areas, so it'll be good. I have read that it limits the drug's impact on histamine, acetylcholine, and norepinephrine. So the side effects are supposed to be less. That's what we need. But of course, we still need validated endpoints across the board. We're still going to need patient-reported outcomes as everyone starts to take this. I don't know what Tonix has planned for that. So I'm going to be reaching out to see if I can try to get in touch with them to see how we can actually aggregate these patient-reported outcomes effectively so we can get a better idea of what is actually happening and address this. But compared to some of the other side effects of the FDA-approved drugs, this one seems nicer. Now, everything is going to come with, side effects. There may be contraindications that we have to pay attention to. If you are also on other medications, you're really going to need to work with your doctor to understand, because this profile is more like a tricyclic. So be careful with serotonin syndrome if you're already on SSRIs or SSNRIs, which many fibromyalgia patients are already on. So that's why this in development is good, but it's going to have a whole education model that we're going to have to work with our medical providers. And I hope that they take the time to work with you on this. If not, that's why we provide you the education for this. And so that way you can know, because this is going to be a multi-pathway medication as well. Again, we don't know until everybody starts taking it, but what they released in their own clinical trials is pretty good. And some of the other common side effects you might see is mouth or tongue numbness, altered taste, tingling sensation, might get a headache. You might see daytime sleepiness, but that was really reduced with this sublingual version compared to the oral tablet versions. They typically did not see weight gain, which is different from some of the other FDA-approved drugs for fibromyalgia. They didn't see as much nausea or GI upset, so that's good because that could be problematic from some of the other drugs. So again, everything still has precautions because of its profile as a TCA and what you have to take a look at. But I mean, it's good to see. It's good to see some investment in fibromyalgia. We still need a lot more investment. This does not mean we quit with any advocacy. We need research development. We need more pathophysiology so that we can actually start to look at other medications like LDN. I know that there's more research going into LDN for like things like ME/CFS. So that's good, but we need more larger cohort studies for fibromyalgia because LDN seems to be targeting more of the neuroinflammation. So that pathway is going to be an important pathway for us to address in science, medication development. What other things, what other treatments can address neuroinflammation? Because we are seeing widespread neuroinflammation for fibromyalgia. If we can get sleep, this might help with the sleep cycle, because disrupted sleep does contribute to neuroinflammation. So that's where this may be more helpful. So we'll see. And that's why I think we need to address all of this going forward and have this as we talk. So as you hear, like, yeah, it's hard. I'm gonna address some of the comments too as we go along. So, Sonia, you're not the only one. And this is why I wish we had a better pathway for decreasing the dosages for people who are like myself, potentially like Sonia, who have more of a hypersensitivity, sensitivity profile to medications on how we process it. And we've never really done a lot of research. There are actual like tests that we can run, pharmacogenetics tests, but they're not usually covered by insurance. So we can see how we metabolize medication. You usually have to pay out of pocket to actually see how this happens, but it's actually good for us to know. Doctors really don't take this into consideration. They don't have much time for it to think about it. So it's really left to the patient to figure this out. If you are more sensitive, I always recommend starting with the lowest dosage possible. If you are able to cut the tablet in half, this one you can't. So anything extended release or anything like that, you cannot crush, cut, or do anything to it. And this one, you do not want to do that either because it has an effect too in the oral, which it already changes for oral mucosa, which they saw side effects for this drug as well. So I don't know. I mean, that's why some of us may remain at a lower dosage. For the study too, they did not have people who are 65 years and older in this trial. So please keep that in mind if you're in that age group. They said you could try it, but try definitely keeping at the lower dosage. And that's why I'm going to actually, when we get into the next PDF, I'll definitely share that as well. So let me go to that. So here's the link. And I'm always, like you said, this is just education information because you probably are going to need to take this to your doctor. If your doctor and yourself are excited about this, or you're like, you know what, this might be something I'm interested in trying. You can take this PDF. It's available on their website, and I just put the link there. Of course, all of this is more geared toward healthcare providers, but again, here at the organization, we feel that you're the patient expert, so we need to give you as much information as possible. So this is what we downloaded. It gives a lot of details. You don't have to necessarily understand all of this, but it's good to actually give this to your provider and you can go through it. It gives some contraindications that you should probably be aware of as well. One thing that caught my attention in that was, besides just being allergic to cyclobenzaprine, is hypothyroidism. Many people in our community have issues with their thyroid. So keep that in mind. I know it's hyper, but I know even with hypo, you can transition in different directions. So just note that, highlight it. If you are struggling with any sort of thyroid condition or you don't know, that is just something to put on your radar for how this affects the whole wide system when it comes to medication. And again, I know that they've talked about limiting the side effects for this medication, and I'm happy to hear that. So that's good. But again, all these profiles, we're all individuals. We're all going to respond differently. I really do hope that it helps. I am hopeful that it can help some of the people, especially at that lower dosage. And if you're finding a lot of relief at that lower dosage, you might want to talk to your doctor. Maybe you don't even need to go up to the dosage that they did in their clinical trial at all. But you can go through this document. And again, here it's dosage administration. So the recommended dose that they used was 5.6 milligrams, but starting dose 2.8. I would probably personally, because I'm so sensitive, would just maybe stay there, because noticing from what I had to do when I talked to rheumatologists around the country when I was doing group medical visits, some of the rheumatologists did tell their patients to take a half of the Flixerol to just decrease the side effects. So around that, that actually milligram might be more efficient for people. So again, don't be afraid to talk to your doctor and advocate for yourself and be like, you know what, I want to stay on the lowest dosage, maybe just see if it helps, and work with your doctor. Again, insist on your doctor managing your medication, figuring out how you can do this, because it's really going to take a lot of medication management here. And especially if you're already on other medications, please keep that in mind, because there's going to be a lot of stuff going on here. Hello, Margaret. Good to see you. Thank you for joining in. Yeah, so Sonia, you're on this border here where it says recommended dosage in geriatric patients. I don't like that term, but this is what they did not measure. But they did, if you are going to take it, 2.8 milligrams administered sublingual once daily at bedtime. So keep that in mind, but also keep monitoring. And that's why I always insist with people when you start a medication, I'll write on the bottle, this can be supplements too. So anything supplements, I'll write on the bottle when I actually started it and I take notes and I only start that one thing at that one time. I don't start multiple things at one time. I don't test. It's just N of one for me and working with try to see what I can. Other things to note is any mild hepatic impairment. So making sure any liver, also check on your renal conditions, anything like that. You just want to make sure you're in check. You can handle this medication. Again, it's sublingual, so it's not necessarily, it's going to bypass that first pass effect. But these systemic changes, and again, long term, because I forgot how long they studied this, but again, we're not in all of these medication studies, they don't study it for long term. Like they don't go past they definitely don't go past a year. So I think how much was this, 14 weeks? I'll have to double check on that and put that in the comments. So 14 weeks isn't what you potentially would be on. So just keep that in mind. Also, it'll give you directions how to take sublingual. As a nurse, I'm learning how to properly take sublingual tablets because many people don't. Definitely miss that fact where you place it. Avoid eating or drinking while you're taking the medication. Do not do not crush or chew the tablets as well. It's kind of tempting when it's sublingual in your mouth to kind of chew. Don't do that. Again, don't miss a dose. Pregnancy. So this is something to definitely talk to your provider about if you are interested in becoming pregnant while you're on this medication. So go through all of this if you're interested in learning more. It has a lot of information. Here again, contraindications. It dives into more of the neural tube defects that can happen. So keep this in mind if you are planning a pregnancy in your life as well, and talk to your doctor. It also says use of contraception. So I don't know how that affects. So I have to look at that further. The one big topic to actually take a look at, because many of us are on multiple medications and its interactions for fibromyalgia. So serotonin syndrome, know what that feels like, know what that looks like. Again, as a nurse in my training, I've actually read through these definitions. No one told me in my younger days of taking a lot of polypharmacy, what serotonin syndrome even looked like. And unfortunately, based on my medical history, I think that's what I was actually going through. So make sure your doctor understands where the category of medication falls for Tonmya, and understand that if you are taking anything that affects serotonin, so any of the SSRIs, SNRIs, you might have to work with your doctor to change dosing strategies. Or if this is something that you really want to try, call your doctor and let them know, because this is super important when it comes to medication interaction. And it's very confusing. I do hear a lot of symptoms that sound like serotonin syndrome that people say, oh, that's just my fibromyalgia symptoms. No, you can get side effect profiles from too many of these medications that interact with the serotonin profile. So just keep that in mind as you are looking at this medication. And it's hard because I think for new fibromyalgia diagnosed people, this is a good thing to have another choice on the thing, because I know a lot of people get prescribed gabapentin, duloxetine. So even though there's Lyrica, for some reason, there's a high amount of people getting prescribed gabapentin and Neurontin first. So looking at these differences and seeing, because those side effect profiles, the weight gain is really tough to lose. So if you don't have to gain weight on a medication, that would be really nice, seeing this side effect profile. And I know we've talked previously about things like LDN, which is another interesting medication that I do want to have more speakers on this channel to talk about. So I just wanted to share that guide with you. You can look through some of the ways it operates, the drug, contraindications, adverse reactions. You're looking for these as well. What was reported in the trials that they did, goes through all of this. They have a full website for this, so you can share with your provider and talk to them. They will be marketing this more. And again, we're going to see this as it comes out and hopefully be covered properly by insurance. But I did want to address that. It's definitely a good drug guide. You can understand the pharmacology, toxicology. So it's just something to go through. And it does have the trial information for you. And so that's why this is available for you over there. So that's one of the big things I just wanted to dive into here from you. Sonia, I don't know if you're able to even try like something like LDN, because the side effect profile for some of that is a little bit less. And I have heard from medical doctors, if it does work for fibromyalgia patients, it works really well. But this is where it gets complicated. So that's why I just wanted to hear from everyone. What are your thoughts? What are you thinking with this new FDA approved drug? Again, we need more information. We need better investments in research, because I think we're still looking at symptom management. So we're managing the symptom instead of going upstream on what's actually problematic for fibromyalgia. Potentially, if we look more at neuroinflammation, widespread neuroinflammation in the brain, we might be at better like management for fibromyalgia overall. I do like the fact that this is focused on sleep. Sleep is hugely important, and addressing that pain insomnia part of fibromyalgia is huge. So that's why I just wanted to bring this up. Please comment later. This recording will be available on our channels on Facebook, YouTube. I just want to hear what your thoughts are. Have you tried Flixeril before? Are you open to trying this as a different version, sublingual version? And again, we will keep you updated. Hopefully we'll get I'll reach out to Tonics to see if we can get an interview too with someone there to talk more about this. It's not available yet. They want it to be available in the fourth quarter, and we will be seeing more marketing across the board once it is available, just like with other pharmaceutical companies. So it'll be interesting. But like I said, this is a good time to actually figure out how to reliably have patient-reported outcomes, how to help our providers provide that information to the pharmaceutical companies, making adjustments, because maybe we will see different results, maybe we'll see similar results. But I'm hopeful, because we need more options to help people living with fibromyalgia, because I know it's a miserable experience. As a person who's lived with it for decades, there are just things and symptoms you're like, I cannot manage. And a lot of the other FDA approved drugs didn't even touch that for me. So I had the worst experience on some of those. I can't even touch those. So unfortunately, I've had to try all kinds of other natural ways to do this. It's frustrating. If I could find a dosage of something that was lower, that would not have dose limiting effects and really bad side effects, I would totally do it, especially when it came to sleep. If I could fall asleep, stay asleep, and then wake up, with some capacity, even if I need a little bit of coffee to wake me up the rest of the way, okay, without being like overly fatigued and dizzy, I would definitely do it personally, because sleep has eluded me for so long. I've worked really hard on it naturally, gotten to a certain point, but it's still one of those things I would love to have some support with if possible. So that's what's kind of exciting with this new medication, and the fact that they're trying to address the sedative effects so that it hopefully would not be long-term and go into the next day. We'll have to see. So keep commenting, keep letting me know. We'll keep updating you on what we learn about the new medication. It is FDA approved, so they got that. They launched it. It's in the press releases. So that's why we're just excited to share. But thank you, everyone. I know I've been missing in action. Just to give you a personal update and an organizational update, I don't know how I did it, but okay, I completed my third semester of nursing school. Wow, was that? I didn't think I was going to make it through, quite honestly. My health symptoms are showing up, unfortunately, in different ways, and I have some new stuff that came down the pipeline too during the middle of the semester, which is really annoying. I think all the stress compounded with everything, I had no idea. And for those of you that are unaware, I enrolled in an accelerated master's in nursing program out here in Arizona. So I moved to Arizona, started this program last year. It's been officially a year. I'm in my third semester. There are 5 semesters total. Last semester was the worst of them all, super grueling. And like I said, I didn't think I was going to make it. We had these content mastery tests that we had to take. which are ATI driven tests for national level. And we had 4 of them. And the hard part was that for some of the classes, if you didn't pass that CMS, you didn't pass the class. So you already had the patient professors, you already had the professor assessments for the class, but you had to take those CMS. One class, the OB maternal one, which is not my strength, had 2, the maternal newborn and the pediatric test. So you had to pass both in order to pass the entire class. So needless to say, I was really, really stressed. But I completed it. I passed all my exams in the first try. I don't know how I did it. Now I'm into the 4th semester. This one's going to be tough because it's critical care. So we go in the hospital for our clinicals, do critical care. Everything's critical care. I like pathophysiology, but some of the nursing strategies for this to be this quick, it's going to be a lot of work, but I want to keep up with everything. So what I'm going to be doing for anybody out there who I got in touch with for interviews, I'm going to send out an email. I'm going to have some blocks of time that you can sign up to do an interview. I want to continue with interviews and producing content for this channel. It's really important to get this content out there, have conversations. I like the interaction. So please, if you can, subscribe to the channel. If you're not subscribed, share that we have a YouTube channel. We have a Facebook page. We have social media channels out there. Share with your friends. We are a national nonprofit organization. We're working hard. We were known as the Support Fibromyalgia Network. We recently changed our name to the Fibromyalgia National Health Organization. The name change was important because it's showcasing growth. So once I graduate from nursing school, I will have an MSN. I'll sit for the NCLEX to be an RN, and I'll figure out how to get clinical training to go further. But this is important because I want to figure out how to change the standard of care for fibromyalgia. I know that's a big moonshot challenge. I have a lot of moonshot ideas that we're going to present to you as well as we go through, but we need to change the standard of care for fibromyalgia. As a fibromyalgia patient, I'm disappointed and I want to do this. As a nurse, I want to create CEUs. So with a master, I can do that. I can start to create CEUs and at least start to educate nurses. I will hopefully collaborate eventually with some MDs that want to create CMEs so we can change the training and education for fibromyalgia forever. Not the same stuff we have heard over and over again. We need to help all of you improve your quality of life. We need you to feel better. That is a goal. That is a huge goal, but we're going to do it. And we're going to do it together. So please let people know we are a very ambitious organization. We will do this as we start to grow too. We're going to need more people to come on, volunteer, also helping with different tasks as well. There is for Project Echo, which I've repeatedly talked about for a while, we want to start training healthcare professionals. If you've seen the EDS Echo, that is what we want to build. So if go to the EDS Society, you can see their Echo. That is what we want to have for fibromyalgia. Exactly. We're going to need people on board. We're fundraising for that. We're fundraising for research, fundraising for education programs, and launching of different group medical visits, because that's huge for me as a health coach. I worked as a health coach with providers who had those groups, and I've been training continuously in functional medicine. I've had extensive training at the Karazin Institute recently as well, but I want to be able to bring on other people. And what I worked for with the company was doing health coaching that was billable for insurance. I was like, wow, it's actually billable with the provider in the room. So I'm trying to transition to the provider so that I can bring on the health coaches and then do this to create a total change of standard of care. I've learned a lot from people like Dr. Ron at the Texas Center for Lifestyle Medicine. If you are in Texas, please try to use the resources if they take insurance too. And their clinic is really good. They have so many group classes and group programs. They also are medical providers that provide treatment. So if you are in Texas, you utilize that resource. Swing Care is developing a lot across the country too. I'm really impressed. We need them to get in every state. I don't know what that's going to take. Ravel Health is another one that we've been working with for complicated chronic illness conditions. You'll see a lot with them on Lyme disease, but they do work with other complex conditions. They work with fibromyalgia. They are nationwide as well. So good news. And so this is huge for us. So please check it out. I'll keep reminding people of these resources, of these medical providers. Shout out to Dr. Pinkston. She is working in Kentucky. If you are in Kentucky, she is a rheumatologist. She completely understands autoimmune conditions. She understands fibromyalgia. She's taking a new approach as well with her integrative medicine training. So there are a lot of providers out there. I'm excited. We're working together. We need more and we need a lot more training. So that is coming down the pipeline. I just need to get through this nursing school without my body going kaput. I did obviously get some new symptoms. I don't know. Besides fibromyalgia, I've had a mild case of trigeminal neuralgia since my sports injury as a teenager. It never got really addressed because I didn't respond well to the medications that were kind of similar to fibromyalgia anyway. And some of the other things with what they had at that time were just I'm really not a big fan of some of the surgeries where I'm like, this doesn't guarantee that it's going to help me. So I've been getting a lot of pain in the right side of my face, but I guess I went to a provider trying to establish primary care. It was a disaster. Recently, I've been getting burning mouth pain. I've lost complete sense of taste, but my mouth has been burning, especially on this right side of my tongue. The burning pain, like all throughout here, which is part of this trigeminal neuralgia, like the nerve, the cranial nerve, but I think it's something more. So they diagnosed me with burning mouth syndrome. I don't know what I'm gonna have to look up treatment with that. It's really annoying. But during school, like especially during some of my high stressful simulation labs and tests, like my face will just start burning and pain. And you can see it in my eyes because my eyes will like either dry out and be kind of red or they'll start, tearing up. It's just, ugh. And it was hard. I thought I was like, okay, I was like going to go to urgent care, maybe just to get a throat culture to see what was going on, making sure I didn't have anything. But I decided to go set up primary care. I double checked to see if it was covered by insurance. So I went in for my appointment. They took my insurance. I paid a copay. But then at the end, I got a big fat bill. Yes, they ran some blood tests. What's odd is my blood tests are actually better than they've ever been before, which doesn't make any sense. So, I mean, we checked for nutritional deficiencies. We checked the TSH and all that stuff too. And actually, my levels, again, even for vitamin D, are the best they have ever been. The doctor didn't even really give me any, because I asked, I was like, well, what can I do for this in the meantime? Sometimes I've been taking zinc lozenge to help with the irritation. That seems to help. But they didn't really give me anything. They're like, well, we'll wait to see what the blood tests show. And then they did run a thing for Sjogren's, which is negative, but I don't know. I've always been autoimmune something, so I'm in betweener. I just don't have a clear cut. So I got a big fat medical bill. And so I thought the insurance was going to cover it more. It's just frustrating because when you get the bill, you're like, what? I should have just gone to see a naturopathic doctor or a functional medicine doctor. I'm like, for the amount that I paid, I was horrified. So this is so problematic in healthcare. We need this. And I do want to work with all of you out there. So becoming a healthcare provider that can help the complicated is really important to me. I know I'm misunderstood at nursing school quite a bit. I had a funny clinical experience with my clinical professor. She meant well, but she didn't know what she was saying when she's like, oh, so what kind of line of nursing are you interested in? I was like, well, I want to work with fibromyalgia, chronic pain, autoimmune, EDS, all the complicated. And her response was, well, why in the world would you want to do that? I laughed. Like I said, she meant well with it, by it. But I know it's funny because that is whatever. And I don't know what it's going to take. It sounds more like primary care in that sense. So I can try to keep everybody at the hospital. I don't necessarily like the hospital experience because in there you have to basically just patch people up and send them home, which is something I struggle with in med surg because I like talking to the patients. I like learning about them. And I'm like, oh, I don't even get to see the end result. Like, how are you? Follow up. It's just patch you up, send you off. It doesn't matter if you're complicated at all. You come in here for an acute symptom, something acute, we address it, and then we send you out the door. So that is not my personality. So I'm going to struggle with critical care quite a bit right now. But I did have community health, which I liked. So the public health, but I did work in a community health clinic. That was exciting for me. The pace worked really well and I could learn. I followed an NP. I followed other nurses. So I liked that. I really liked having contact with patients and talking to patients uh, at a regular like pace, and then also answering questions, learning about them. And even when I worked at the lifestyle center on that community health clinic, we were addressing diabetes, endocrinology. I liked having conversations with people about nutrition. What are they struggling with? I liked answering their questions. So we'll see how I survive fourth semester in critical care. I'm not sure what fifth semester brings as far as clinicals. I think they prepare you for the world. um, they're already talking about preceptorship, and I'm like, oh my gosh, at a hospital, I'm like, how can I work with a primary care and get matched up? Because that's probably my thing. Just because I mean, I just want to work with all of you. I mean, all of you have been my inspiration. This is what I'm going to nursing school for. I want to help in advocacy. I want to get into research as well. So I'm a little bit of a different nursing student than what they probably understand at nursing school. So it's a lot to navigate through, but I'm going through it. And thank you everyone for being most supportive. Hopefully my face can figure out what's going on. Like I said, I still can't taste anything. It's super annoying. And the flare ups get pretty bad. Luckily, I had a professor that gave me some topical stuff that I was using on my face. I smelled really bad during a presentation, but I had to do what I had to do. So now I'm trying to see. I know ice seems to help, or when I drink really cold beverages, it really helps on the side, which is bizarre because I'm normally super sensitive to cold. So if anyone out there is dealing with burning mouth syndrome, has that diagnosis, please let me know because that is a new thing. I'm like, wow. I mean, I've kind of managed the trigeminal. It was a mild case, but I don't know if this is an explosion of a new case. So anyone with experience with that, I know TN is a headache disorder, working with the headache advocacy groups. So I'm going to try to learn more from them, but there's a lot going on over here. So thank you everyone for tuning in. I just wanted to say, hopefully I need to figure out the pace of this. So sadly, I got stuck with clinicals on Saturday and Sunday. So you won't be seeing me on Saturdays and Sundays that I have clinical. I think for the month of September, it's Saturdays and Sundays. October, I think it's just Saturdays. So maybe I'll try to jump on Sundays. But I do want to get my interviews out there. So anyone who you feel ignored, that I didn't get back to you, I'm sorry. I will send you an email. Let's get a calendar together. We may have to book way in advance for different things. My schedule, there are some days where I don't go to school. Hopefully they don't change that. It's really annoying because on some of those days they're like, oh yeah, we can add an extra test for you. That's what they did. So I had my schedule. I put it in my calendar. I tried to be ahead of it so I can plan interviews with other guests. And they kept switching the schedule. They're like, yeah, we're going to move that CMS from Monday to Tuesday. So you have an extra day to study, which was fine, but like I can't plan anything. And I'm a very planned person. I time block my schedule so I can study, and I want to commit to all of you. So I'm very frustrated right now a little bit with the schedule changes, but I know in the long run, being able to be in healthcare as a nurse is going to be super important for what we're going to build in the future. But I do want to get these guests onboarded for you. If you have certain guests that you've seen that you want to hear from, let me know. I know I'll be bringing in some of the health coaches for our health coaching groups that we need to continue, get you involved with them. So they'll be talking about different health coaching, different things. We do want to have other guests. I want to bring in Ravel Health. I want them to talk about the work they're doing. We're going to bring Crystal back. We're going to talk about advocacy. We need to talk about advocacy because advocacy needs to continue. We have the fight of our lives right now for public health. So let's go at that. So thank you again, everyone. Yeah. It's a part of the process for the challenges, right? That's where I tell people I was able to reclaim some of my health, but I'm definitely not cured. I definitely don't even say I'm in remission because the amount of stress, my body just doesn't like it. I'm going to have to go after school to like hide on the mountain for a while, hide in Arizona for a while. Thank you, Sonia, so much. I definitely, again, I'll try to keep everybody with more consistent. Sonia, let me look this up. So I have a feeling maybe because the drowsiness component, the sedative component, this is something to be aware of because as we talk about it too, fall risk, also brain health. So affecting acetylcholine is something that we've talked about in other medication. So this is why things like acetylcholinergics, I think that cholinergic, something like that. Let me correct that in the description right now as my brain fog is coming up. But this is why you're starting to hear stuff on Benadryl affecting brain health, like long-term usage of Benadryl use affecting brain health down the line. So I think this might be the concern. This is just a guess. I haven't talked to them. This is a good question for me to ask them why they limited to a particular age. But I'm figuring it might be brain health and fall risk because of the sedative properties too, because they couldn't control that. You know, you don't want those things happening. For some of those things, when it affects acetyl, like choline, again, this is where the drugs, we talk about it with Alzheimer's and brain health, also the drying component. So there is some new research with that. And that's why it's correlated to things like when you hear conversations about long-term use of Benadryl, they're starting to discourage people from doing that and looking at the other antihistamines, the second generation, because of brain health properties. So I'll try to find more information on that for you, Sonia, and I'll try to see if I can post it. Again, I'm starting to get brain foggy. I'm so tired. I just started fourth semester. I can't be this tired, but thank you everyone for tuning in. Again, we'll be posting more videos shortly and I appreciate all of you. Bye.